The brain contains the densest vascular network in the human body, 1.6 million kilometers of blood vessels nourishing countless nerve cells. But whilst this network has helped endow humans with greater intelligence, it's also what makes the human brain especially vulnerable. In China, on average, one person experiences an acute cerebrovascular disease every 10 seconds, and one person dies from it every 28 seconds. Are we doomed to live in fear of disease? How should we respond?
意识不清楚，现在完全是偏瘫的，颅内大血管堵了，这是比较严重的脑梗。重度卒中良好预后率只有10%几，10个病人里有1个以后能自理，那9个都不行，还有死亡的。
According to the World Health Organization, 1 in every 4 adults over the age of 25 worldwide will experience a stroke. Among the top 3 causes of death in China, stroke exceeds heart disease and cancer, accounting for approximately 22% of the overall mortality rate.
它的这个片子已经出来了，你看梗的地儿很多。 所以为什么它这次这么重呢？这次是一个大主干血管，急性的脑梗。
Advanced imaging shows that the white areas in the patient's brain correspond to lesions caused by cerebral infarction, whereas in a CT scan of a normal person, these areas would appear black.
脑卒中它有2种，一种是有血管堵塞了，比脑子没血了。 一种是出血性血管爆掉了，
它5分钟如果脑细胞没有得到足够的血液供应的话，它就可以产生一个不可逆性的死亡。所以这个是跟时间赛跑。
Vascular lesions constantly threaten the human nerve center, endangering life. Why are humans' cerebral blood vessels so fragile? Why does stroke occur only in the human brain among living organisms? The rapid evolution of the human brain may have made the onset of this disease inevitable.
脑的血管为什么那么密集呢？是因为脑的功能，脑控制我们的运动、我们的感觉以及情感，都是由我们的脑这个司令部来控制的。它需要非常丰富的血液供应。
跟其他地方都不太一样，它需要大量的血液带着氧气、带着营养到达大脑的脑组织中，为它提供很多的能量，这样的话，大脑才能正常的工作。
Over the long course of human evolution, brain volume has continuously increased. One consequence of this is that human brains have a greater density of blood vessels than those of other animals. If all cerebral blood vessels were connected end to end, their total length would reach 1.6 million kilometers.
进入脑的这个血管呢，它的相同级别的这个血管的直径要比其他部位呢细。 所以呢，血管的粗细以及血管网的密集程度上呢，脑的血管呢是更密集，直径更小。
The vast number of cerebral blood vessels nourish the countless neural networks within the brain, which control our breathing, heartbeat, thinking, and consciousness. As the source of our life, the extraordinarily long and thin cerebral blood vessels are more prone to stenosis and blockage than other blood vessels. Moreover, the brain cannot pulsate, expand, or contract like the heart, lungs, or intestines. Consequently, the walls of cerebral blood vessels are thinner than those of blood vessels in other body parts.
我们的血管壁一般3层，脑子的血管呢少1层，更薄，更容易破。
This is an ancient therapy that is still popular in India. It is known as bloodletting and was once a standard treatment for strokes and the like. In ancient Greece, physicians developed theories about diseases such as stroke. They believed that these illnesses resulted from an imbalance of blood in the body, so reducing blood volume by bloodletting was one way to treat such conditions.
是18世纪，在西方，他们认为生了病以后，病邪进到全身，所以血液里边有很多病邪，必须放血把它排掉。
美国之父华盛顿就说，他骑马说外伤以后发生了类似于卒中的一些表现，他们诊断为把他卒中。
结果他就说，他说我过5天，过几天我要在国会上讲话，所以你们得赶快给我治好。他的一帮医生呢，就是说，那咱们就用最好的办法放血，这样放到第3次还是第4次的时候，他就不行了，然后就死掉了。
In the 1930s, modern medicine concluded that bloodletting should no longer be used to treat stroke. So, how can the true cause of disease be identified within the complex and delicate neurovascular network? As early as the late 18th century, medicine entered a new era. To find ways of diagnosing diseases deep within the human body with minimal harm, physicians began searching for new diagnostic methods. The renowned University of Würzburg is situated on the banks of the Main. In 1895, in this historic physics laboratory, physicist Wilhelm Conrad Röntgen made a world-changing discovery by accident.
Absolut begeistert von seiner neuen Entdeckung, und er hat ja sehr gründlich verschiedene Substanzen untersucht. Zuerst Holz, dann Gewichte. Dann hat er sein Gewehr geröntgt, er war ja ein begeisterter Jäger. Und dann hat er sich entschlossen, die Hand seiner Frau Bertha zu röntgen. Und das war das allererste Röntgenbild überhaupt, das es auf der Welt gegeben hat. Innerhalb von wenigen Stunden sozusagen ging diese Meldung rund um die Welt.
The discovery of X-rays enabled imaging of the internal structures of the human body, which greatly encouraged Western medical practitioners. With X-rays, one can roughly infer the location of lesions by observing deformation of the skull. However, this indirect imaging is insufficient for detailed visualization of cerebral blood vessels.
In order to try to resolve the main problem at that time was to see what's going on in the brain of some patients, because there was no other such efficient aside the pneumography.
This scene depicts how the doctor performed brain imaging on a patient at that time. Air was injected into the brain, enabling visualization of the ventricle's morphology to infer the location of brain tumors and other lesions.
用空气作为一个造影剂，不打空气的看不到，打了空气看到脑实了，间接可以判断肿瘤在什么位置，但是这个是检查很痛苦。
In 1921, Portuguese neurosurgeon Antonio Egas Moniz realized that it might be possible to enhance image clarity by injecting a chemical substance into cerebral blood vessels that are difficult to image. This chemical substance had to meet two conditions. It could not be penetrated by X-rays, yet it could be safely introduced into the brain's capillaries.
He put several bromide solutions in different small tubes and make the X-ray and study which is the better radio opacity, the best contrast.
This image was captured by Moniz after he placed test tubes containing chemical solutions of varying concentrations into the brain of a cadaver. After dozens of experiments, he determined that a contrast agent called sodium iodide was optimal in both imaging clarity and safety.
Only in 15 animals, the Moniz and Lima achieved to see the arteries of the dog.
On the afternoon of June 28, 1927, on this very operating table, Moniz first attempted to inject a sodium iodide contrast agent from the patient's neck into the cerebral artery and succeeded. With the aid of contrast agents, humanity saw for the first time the morphology of cerebral blood vessels without opening the skull.
它做成了，迅速的传遍全世界。没有铆粒子这个血管造影，就不可能有介入，因为介入的每一步都是在造影的监视下进行的，对医学的发展起了天翻覆地的变化。
In the 1950s, Wang Zhongcheng, one of the pioneers of Chinese neurosurgery, completed the first cerebral angiography in China via carotid artery puncture, going on to author China's first monograph on cerebral angiography. With the advancement of technology, contrast agents of various compositions and imaging devices have been used to help visualize different types of blood vessels. This is a cerebrovascular surgery that can mean the difference between life and death. The patient has a critical artery in the brain bulging into a blood blister that could rupture at any time. To prevent the rapid, high-pressure blood flow from continuously impacting the paper-thin blood blister, surgeons have established a new bypass route for the affected blood vessel. But whether the new route can effectively deliver blood is not something that can be accurately determined by the naked eye alone. The doctor injects a fluorescent contrast agent into the patient's blood vessels. On the screen, the areas with fluorescent flickering represent imaging of normal blood flow, indicating successful establishment of the new vascular pathway. The fluorescent contrast agent is undoubtedly a powerful tool in the treatment of vascular diseases.
有了血管造影之后，对于血管病的治疗就突飞猛进。只要看到，我们后面就有办法给它解决，这个起到非常重要的作用。
But visualization is only the first step in treatment. Before the 1950s, although breakthroughs were made in cerebral angiography, Moniz initially injected contrast agents into the cerebral blood vessels via exposed carotid arteries. It was a method, however, that was far from perfect, with drawbacks ranging from significant imaging-related trauma to limited accuracy in defining the affected area.
一开始呢，做脑血管造影的时候呢，是这个神经外科大夫和放射科大夫合着一起来做。那么神经外科大夫呢，就是在颈动脉直接的扎个针进去；那么放射科大夫呢，就是连上一个导管，然后往里头打造影剂。
Enabling the contrast agent to accurately reach the lesion within the blood vessels without incising them remains a technical challenge, impeding the advancement of treatment for cerebrovascular diseases. A turning point occurred in the late 1920s. German cardiac surgeon Werner Forssmann risked his life by incising his own vein to insert a 65-centimeter long catheter into his heart, completing the world's first cardiac chamber imaging. With his success, a new era of vascular imaging within the human body dawned.
你看这个导管技术，你能插到心脏，那我也能插到脑子，因为脑血管或者脑子是最复杂的，打破神经系统这个正区、禁区，来应用到我们的脑子、脑血管和脊髓。
Nowadays, with catheterization, doctors no longer need to make incisions in the neck, but instead use a minimally invasive puncture technique that allows the contrast agent to enter the brain more precisely and with less trauma. At this moment, the doctor makes a 2mm incision in the groin. Guided by imaging, the treatment device is advanced through the pre-inserted catheter pathway, traveling up the femoral artery and through tortuous vessels to reach the targeted area of the brain and treat the patient's condition. Professor Liu Chengji, now more than 100 years old, is one of the earliest pioneers of cerebral vascular surgery in China. In the 1960s, Liu Chengji, working in the neurosurgery department at Nanjing General Hospital of Nanjing Military Command, had the opportunity to treat many patients with cerebrovascular diseases. It was imaging and catheterization that made the diagnosis of many cerebrovascular diseases possible.
好多的脑血管病啊、动脉瘤啊、畸形啊，都有的。出血你找不到出血的地方，出血的原因找不到，那就毫无办法。那个时候是毫无办法，只有在动脉造影中间把这个病变发现了，你才能治疗。关键问题在诊断。
At that time, many large general hospitals in China had a department called the cath lab, where one of the main responsibilities of doctors was imaging, image interpretation, and issuing imaging diagnostic reports. This profession emerged in the West with the advent of imaging and catheterization. At that time, angiographers worldwide only performed diagnosis and did not engage in treatment. Around the same period, an accidental discovery made by American angiographer Charles Theodore Dotter elevated radiology from being solely an auxiliary diagnostic tool, opening the door to the development of intracranial endovascular therapy.
1963年，他在一次意外的造影过程中发现郭动脉很狭窄，病人他就插个导管进去，先把它给扩开了。 扩开以后，他就说那病人可以出院了。外科医生说不行，我们要观察1个星期。观察1个多星期，病人越来越好，越来越好，在满地走，Dotter一下就出名了。
Following Dotter's suggestion, angiography began to change. What had originally been a purely diagnostic technique became a therapeutic one. Thus, intracranial endovascular surgery was born.
现代意义上的介入治疗就是从 Dotter 使用这种导管去扩张狭窄血管开始的，单纯的诊断性的一个方向，带入了治疗的这样的一个广阔的前景里面，这个是非常非常关键的一次变革。
In 1972, Liu Chengji became the first in China to perform selective angiography using the same method.
椎动脉造影这是我做的。 开头的时候都是用普通的管子，塑料管，我就从这个股动脉这个地方，就是插个管子，插个塑料管，往上送到主动脉弓这个地方的话呢，它就顺着就到椎动脉去了。
Breakthroughs in cerebral angiography and catheterization have ushered in a new era for cerebrovascular treatment. However, because cerebral blood vessels are more complex and fragile compared to other body parts, pinpointing lesions within the extensive vascular network has become the key in modern cerebrovascular disease therapy. This digital subtraction image is specifically designed for vascular visualization. Unlike conventional X-rays that produce flat images, digital subtraction angiography can isolate cerebral blood vessels as fine as a few microns. It acts like a satellite navigation system for the brain's vascular network, helping physicians better identify the pathways to vascular lesions.
因为它把骨头把什么都剪掉了，这样你的影像变得非常清楚了。对，相当于你把背景全都删掉了，就是一个血管，那就非常好，非常清晰了。那当然就造成了这个整个造影和介入的改变。
The latest vascular imaging technology has opened a new pathway for the treatment of cerebrovascular diseases. In the early 1990s, Ling Feng, as the leading figure in Chinese interventional neuroradiology, completed China's first book on neurointervention. She was the first to combine the theory and practice of neuroradiological imaging for cerebrovascular diseases, propelling China's treatment of cerebrovascular diseases into the first rank internationally.
咱要是打冰盐水，这个就得堵在左边，是上矢状窦里打。
The lesion location is apparent in three-dimensional imaging. Using a catheter and thrombectomy devices, the physician successfully removed the thrombus from a 2-millimeter blood vessel. In modern surgical procedures, physicians can reach lesions within cerebral blood vessels through catheters and other instruments without craniotomy to clear the vessels and treat the patient.
有这么一个词，就是离苦得乐，实际上就是帮助病人的时候，他能够减少他的这种损伤，让他得到应该得到的健康和结果。所以就有人去尝试神经介入，就是从血管内去治疗。
神经介入是一个新发展起来的一个技术，或者是成为一个学科。不管是血管堵了、狭窄，还是血管破了、突出，它的优势在于它用血管的腔道，就是在血管里面进行操作。所以神经介入的话，从一开始出现了这项技术，到现在的话就得到广泛的应用，并且发展得非常迅速。
From the discovery of X-rays in the 19th century to today's digital subtraction and three-dimensional navigation technologies, and from open vascular puncture to the invention of cerebral vascular catheters, neurointerventional medicine has undergone a century of remarkable transformation. As one of the most complex organs in the human body, the brain is vulnerable to diseases that inflict pain, helplessness, and even death. Countless physicians have devoted themselves to combating these conditions, yet the challenge shows no sign of abating. But one thing is for sure, as our understanding of the brain deepens, neurointerventional specialists will continue to push forward into the uncharted territories of the cerebral landscape.